Section 1 is Introduction to AI. Artificial intelligence or AI refers to the ability of computer system or machine to simulate human intelligence in performing tasks such as learning, problem solving, and decision making. In simple terms, AI enables machine to process information and make decisions similar to human. In healthcare, AI helps doctor analyze medical data faster and improve diagnosis accuracy. Next is section 2, AI in healthcare evolution. Okay, so based on this slide, AI in healthcare has evolved from traditional diagnosis method to advanced digital system and intelligent technologies. This shows how healthcare has improved over time. In the past, doctors rely on manual record and experience. Today, AI can analyze large amount of medical data quickly and accurately, leading to better patient care. Okay, next is the section 3, which is weak AI versus strong AI. Okay, so as you know, weak AI and strong AI have a big comparison. For the weak AI, they have designed for a specific task, limited scope, cannot think like human, but weak AI used in most healthcare applications today. However, for the strong AI, they can think, reason, and learn like human. They can perform multiple tasks independently. However, this system does not fully exist yet in real-world application.
Assalamualaikum. My name is Muhammad Naim Zahidi. I will explain the input features used by the AI system. First is asymmetry, where one half of the lesion does not match the other half. Second, border irregularity, meaning the edge is uneven, blurred, jagged, or not clearly defined. Third, color variation, where the lesion contains more than one color such as brown, black, red, white, or blue. Fourth, diameter, when the lesion is larger than 6 mm or appear unusually large. Fifth, evolution, meaning the lesion change in size, shape, color, or appearance over time. Six, symptoms, when the lesion causes bleeding, pain, itching, or discomfort. I will now pass the presentation to the next member.
Show the overall decision tree model for our AI-based skin cancer detection system. Basically, the system starts by checking whether the skin lesion is asymmetrical or not. From there, the AI continues by evaluating several important features like border shape, color change, lesion size, and symptom. At the end of the process, the system will classify the lesion into 3 risks, which are low risk, medium risk, and one, which focuses on non-asymmetrical lesion. First, the AI check whether the lesion is asymmetrical. If the answer is no, it's moved to question 2. Here the system check whether the lesion has changed in size, shape, or color. If there is no change, the lesion is classified as low risk. But if there is a change, it will be classified as medium risk. Move to branch 2, which focuses on asymmetrical lesion. If the answer to question 1 is yes, the system continues to the question 3, which check whether the lesion has irregular border. If the border not irregular, the AI moves to question 4 to check color variation. But if the border is irregular, the system moves to question 5 to check whether the lesion is larger than 6 mm. This branch shows the final risk classification result. For question 4, whether the answer is yes or no, the lesion will be classified as a medium risk. So next for question 5, if the lesion is not larger than 6 mm, the system moves to question 6. If there is a bleeding, pain, or itching, it's classified as a high risk. Otherwise, it's medium risk. If the lesion is larger than 6 mm, the system moves to question 7. If there is a recent change, it's classified as a high risk. Otherwise, it's a medium risk. Overall, this decision tree helps the AI system evaluate skin lesions step by step using important features such as asymmetry, border, color size, lesion change, and symptom. Based on all these conditions, the system can classify the lesion into low risk, medium risk, or high risk, and provide a suggested action for user. However, it is important to note that AI system only work as an early screening tool. It does not help replace professional diagnosis from a doctor or dermatologist.
Hello again. I will now explain the decision outcomes. For low risk, the lesion is symmetrical and show no recent change. The action is to monitor the lesion regularly and observe any future changes. For medium risk, the lesion shows one or two suspicious features such as change, color variation, asymmetry, or irregular shape. You should consult a doctor or dermatologist for further checking. For high risk, the lesion shows multiple warning signs such as irregular border, size greater than 6 mm, recent change, bleeding, pain, or itching. You must seek medical consultation immediately.
Right. So let's moving on to the section 8. Let us look at why the decision tree model is particularly suitable for our clinical application. For the first, decision trees offer unmatched transparency. So unlike the black box models, they are highly intuitive and easy to interpret, making them accessible to both medical professional and patient. And second, a decision tree maps out the entire reasoning process step by step. So this visual journey allows us to track exactly how the model evaluates data at every single intersection. And then the third, we go to the, it provide a highly structured framework. So it organize complex knowledge clearly into specific condition and define the outcomes. So transforming raw clinical data into actionable logic. Fourth, this structured approach is precisely how we can explain why a specific lesion is classified into low, medium, or high risk categories. So it grounds the final risk assessment in clear, auditable clinical checkpoint. Finally, because of this clarity, decision trees serve as excellent tool for medical education and knowledge representation. So they provide a standard, shareable format that help train students and align clinical team on diagnostic pathway. Yes, that's all. So let's continue. Right, so moving on to the section 9, let us look at the concrete rules supporting our decision framework. So this table translates clinical observation directly into actionable if then statement categorizing risk into clear outcome. So first, we establish our basic baseline. So rule number one, so dictate that asymmetrical lesion with no recent change is classified as a low risk. However, rule 2 is introduced a crucial caveat. So if a lesion is symmetrical but has changed recently, it immediately elevate to medium risk. So next, we look at factor that trigger a medium risk assessment. Rule 3 covers asymmetrical lesion that maintain a regular border and a single color. Meanwhile, Rule 4 serves as a vital clinical safety net. Any presence of bleeding, pain, or itching automatically warrants a medium risk classification regardless of shape. So finally, we address our highest priority triggers. Rule number 5 define a classic high risk profile. An asymmetrical lesion with irregular borders, size greater than 6 mm and recent change. So similarly, row 6 highlight color variation, marking asymmetrical lesion with more than one color as high risk. For any complex case falling outside this exact parameter, row 7 act as catch-all. So firmly recommending an immediate medical consultation. So that's all for my part. Thank you.
Hi, Assalamualaikum. My name is Farah. Okay, for the limitation of the model, however, this model also has several limitations. First, it may oversimplify the process of detecting skin cancer because real medical diagnosis is much more complex. Second, image quality such as blurry image, poor lighting, or wrong angles can affect accuracy. Beside that, not all skin cancer follow the same pattern. So this system should only be used as an early screening tool, not for final diagnosis. Okay, in summary, this decision tree model helps classify skin lesion into different risk level based on key features and symptoms. It provides useful recommendation, but it should only be used as a support tool and not as a replacement for professional medical diagnosis. Thank you.